Medical Records Chapter. As leadership surveyors, we validate hospital compliance to the standards addressing the structure of the Medical Records Department and its required policies and procedures. We do not review the implementation of standards addressing entries and content of medical records. Medical records or health information is the backbone of patient care. It is where the care team communicates towards an integrated care plan. To ensure continuity of care and patient safety, medical or patient records must be well managed. MR5, complete and accurate medical record for every patient. This standard provides details for MR4. Hospitals need to identify in a policy who are authorized to make entries in patient records. The policy should state requirements to ensure complete and accurate documentation. Within the same policy or in a separate one, the hospital must describe how it handles delinquent files, medical records analysis data and reports to be reviewed to ensure compliance with the standard. MR8, implementation of diagnosis and procedure codes. In line with national laws and regulations, hospitals must use diagnosis and procedure codes to facilitate in national level healthcare planning and identification of priorities. The standard is verified during unit visit activity to the Medical Records Department. Staff may present in the hospital information system or in the physical patient records how codes are documented. MR9, medical records availability in a timely manner. To ensure continuous care provision and proper communication of patient encounters, medical records must be available during all episodes of service delivery. Compliance with MR9 is verified through review of medical records access policy. In cases of paper medical records, a monitoring process is in place to ensure availability of records within 30 minutes of request. This can also be verified during visits to the emergency department and to the outpatient clinics. Medical records working hours is verified to assure records availability any time of the day. MR11, managing voluminous medical records. Chronic and prolonged care results in the need to have multiple volumes to maintain intact patient care data. The hospital needs to have a clear process on how integrity of patient records is preserved. To review voluminous records management process, we review the Medical Records Department policy and observe its implementation during the unit visit. If a thinning process is implemented, this must be guided by a policy that meets relevant regulatory requirements. In cases of electronic medical records, the linking of records may apply if the hospital has multiple softwares or programs to manage patient care. MR14, release of medical records. The hospital should safeguard the confidentiality of patient information. Hence, a strict process must be implemented to guide the release of medical records for patient care and other purposes such as committee reviews and improvement activities. The hospital has to present its policy on release of medical records. The policy should describe the approval mechanism for release of patient records for non-care related purposes, a logbook or a tracking sheet for release of medical records to be reviewed during the unit visit. MR16, medical records forms management. Forms guide the implementation of care-related policies as they include the data elements to be filled during patient care delivery, such as patient assessment forms, surgical safety forms, and the many forms that make up the content of medical records. The hospital must ensure that the content, format, and approval follow a structured process to ensure consistent and complete documentation. MR16 is verified through the review of Medical Records Review Committee or Forms Committee meeting minutes that discuss approval of forms.